Did you know 383,000 people in America suffer from cardiac arrest each year? But 200,000 of those lives are saved each year by CPR. CPR, as defined by the American Heart Association, is cardiopulmonary resuscitation. It is where we act as the heart's pump when someone's heart stops beating. If you perform CPR, you can triple the person's chance of survival. These are just a few quick facts that about CPR from the American Heart Association. Also, for every minute that someone does not receive CPR after they've gone into cardiac arrest, their chance of survival decreases by 10%. The longest successful CPR ever recorded is 96 minutes, and the person survived. It can take several minutes for medical personnel to arrive after they've called. So having as many people CPR certified is the safest route to go. That way, once someone gets tired, the other person takes over, and you have somebody there to record. When you are CPR certified, not only are you certified in CPR, you are also certified in first aid and an AED. An AED is an auto externatory defibrillator. It is a device when placed on the patient's chest that is in cardiac arrest that will measure the heart rhythm, and if it's a shockable rhythm and they need to be shocked, it will shock them and get their heart back into the correct rhythm. Most of these AEDs will walk you through everything. It talks to you. It tells you when to push the button, when to not touch the patient. So it's very easy to use and a very, very good lifesaver. And the first aid that comes along with CPR will teach you how, if someone is having a major bleed, how to control that. So all the information you learn during CPR training is very, very helpful. CPR can save many lives. It may save your children's, your spouse, your parents, your life, or even a stranger's life. According to the CDC, most people that witness cardiac arrest do not perform CPR because they are afraid they will do it wrong. That information is incorrect because CPR, as I mentioned before, 3 times triples the rate of survival. So performing CPR will not hurt. It can only help. We want as many people trained as we can because you never know where it may happen or how many people you'll need to help you. So we strive for each employee to be trained because we never know when an emergency situation may happen. And it's a very simple concept. It's a 30-to-2 ratio. That means 30 compressions to the chest, 2 ventilations, which is what they consider mouth to mouth. But the American Heart Association has now deemed it, some people don't want to do CPR because they don't want to put their mouth on someone. Well, they have research has shown that if only you do compressions, it increases their chance of survival high. It's really high. So you don't have to do the mouth to mouth, which will stop a lot of people from wanting to be CPR certified. There's the being certified is, like I said, it's easy. It's life-saving. It is about a 2 to 3 hour course. And I think that if you get put in the situation where you have to use it, that you would be very, very thankful that you had this training. or that person's family that you saved lives will be very, very thankful. Most cardiac arrests, 9 out of 10, happen outside of the hospital setting, means on a regular day. It can happen at home, school, work, on the street. So you never know when it might happen and when you could be the person that saves someone's life. Just remember, CPR saves lives. And if it was your family member, you would be so thankful that someone took the chance and went through this training and were CPR, first aid, and AED certified. So I urge all employers to get certified and be willing to save lives in the event of a cardiac arrest or any other medical emergency.